Good evening, I'm Juliana Falk. John and Nina have the night off. Our top story tonight, a case of the mumps has been confirmed in Fond du Lac. The Fond du Lac County Health Department tells us they were notified on July 3rd that a child from Jesus Little Lambs Childcare tested positive for the mumps.
These letters were sent out to parents whose children attend the daycare. One is an exposure notice, making parents aware that a child at the daycare tested positive for the mumps so they can watch for symptoms in their own children. The other, an exclusion notice sent to parents whose children may be under-vaccinated or not vaccinated at all, explaining the guidelines to follow before returning to the daycare. Jesus Little Lambs Childcare sent a statement saying they're working with the Fond du Lac County Health Department. Kim Miller with the health department says the child who tested positive has been vaccinated.
Time points of when somebody can first get that dose would be that 12-month or 1-year mark. And then the next time that child can get that last or second dose of MMR would be when they're around 4 or 5 years old.
Miller adds the child is just under 2 years old, so they're vaccinated as much as they can be for their age. The CDC says 2 doses of the mumps vaccine are 88% effective. 1 dose is 78% effective.
It isn't uncommon to see a positive case of mumps in somebody that would be vaccinated with 1 or 2 doses.
Miller says she isn't sure how the child came in contact with the mumps, but says it could be just a plane or car ride away. She adds symptoms in this particular case could pop up between July 10th and 23rd. So if your child might have been in contact, be sure to keep an eye out for symptoms.
And here's what you should look out for. The primary sign is swollen salivary glands, which causes cheeks to puff out. You could experience pain while chewing or swallowing, fever, headache, muscle aches, weakness and fatigue, or loss of appetite. The best way to prevent mumps is to be vaccinated between the ages of 12 and 15 months and again between the ages of 4 and 6 years. It's spread from person to person through saliva.